Thanks so much. Welcome, everybody, and thanks for joining this session. My name is Alana Barton, and I'm the Director of Media Programs at Population Reference Bureau, or PRB. During the next few minutes, I'm going to give you all an overview of a community radio training program for youth journalists across Malawi that was supported by HP+. I do want to remind everyone that the second half of the session is going to be dedicated to Q&A. So please, I would love to have a short but productive discussion at the end. So as I'm going through the presentation, just think of any questions you might like to ask, and then don't hesitate to speak up when I invite you to do so. I'm going to unpack the elements and accomplishments of this program by answering a central question, and that is, what happens when youth have the mandate and the tools to tell stories about reproductive health that are most important to them? We'll touch on the many people, entities, and organizations that mobilize to improve youth-focused health services through the initial engagement of youth journalists. So what problems was this program designed to address? Malawi's National Youth-Friendly Health Services Strategy, which was adopted in 2015, was written to improve health service access for the country's young people. And by that, we mean people ages 10 to 24. But for the policy's goals to be met, communities had to know that the policy existed and what it said. So our first objective here was to engage young Malawians in dialogue about how advocacy around reproductive health could improve their opportunities and well-being. And our second was to break down barriers to conversation among youth and between youth and other members of the community, especially those in decision-making roles. Our hope was that by doing these things, we would inspire whole community action to make sure health services and policies aligned with the real needs and concerns of youth. When about half of all Malawians are younger than 18, and 2/3 are under 24. When I say youth, I really mean most Malawians. We decided to work through radio, which is by far the most popular form of media in Malawi, to achieve the outcomes that I just mentioned. To start off, we formed long-term partnerships with 7 community radio stations across 6 districts in Malawi. Each station designated 1 or 2 senior reporter mentors to work with the youth journalists. Our training started in May 2017, and each week, in collaboration with a Malawian researcher, we produced a bulletin about a different youth or health theme. The bulletins include an overview of the weekly theme, current facts and data for the topic, a short resource list, and some reporting tips and source contacts to get our youth journalists started. The youth reporter and mentor teams at each station then discuss the weekly themes, and they decide the most relevant way to cover the topic for their area. In my opinion, one of the reasons this activity is so effective is its decentralized structure. The bulletins are a springboard to context-specific content. To create all of their programming, our youth journalists must get into their communities and ask questions. They visit youth-friendly health service sites and they gather monthly data on services provided. They speak with traditional leaders and local officials about what existing policies say, and they challenge why sometimes these policies aren't enforced. They engage with parents and teachers groups, as well as religious groups and peers. This represents a real transformation in who's driving conversations about youth reproductive health, and even whether those conversations happen in the first place. Many of the topics we've covered over the program's lifespan, from menstrual hygiene to gender-based violence to teen pregnancy, are shrouded in taboo and stigma, and often get swept under the rug. A critical part of what made this program successful was simply giving youth a mandate to ask questions and to collect evidence, facts, and personal stories about these little discussed topics. Their actions really opened up channels of communication among many different groups within the communities we worked in, and motivated these groups to not just talk about these things, but get involved. Among the most consistent drivers of that involvement were the youth listening clubs that formed in each of the communities we worked in. These groups would hear the programs together, talk among themselves about what problems were exposed and how best to address them, and then they would lobby community members for support in that problem solving. So I'm going to talk about some of the results this program has achieved, although unfortunately I don't have time for more than a cursory overview. I do want to point out that we have a map of Malawi in the center of this slide and that the districts that we are active in are highlighted. For one, the results of this project are sustainable. Our partner stations now have a permanent orientation toward health coverage and inclusion of youth voices, and we've really seen that commitment even as our support winds down. We've worked to combat stigma and harmful gender norms by addressing them directly. When radio programs in Zamba district, which you'll see in the key here, covered how girls were skipping school due to a lack of resources for menstrual hygiene, we saw layered reactions. And this is a really good example of the whole community effort I was talking about. A group of community mothers started making sanitary pads for schoolgirls and leading hygiene workshops. Teachers built private changing rooms for girls on school premises that they didn't have before, and they used funds collected from the community to do that. The all boys radio listening club in that community recruited classmates as monitors to report incidents of bullying that were linked with menstruation. We've also seen increased uptake of youth-friendly health services directly following radio programs about those services. In just a couple of examples, HIV testing numbers for pregnant teenagers tripled in Nkota after radio programming about the importance of testing to reduce mother-to-child HIV transmission. Gender-based violence reporting quintupled after programs aired that defined and explored the harms of GBV. The programs have also improved service access. After reporting in Mangochi on the rural communities left without youth-friendly health services, after the closure of 4 mobile clinics, all 4 clinics reopened. We've seen community engagement from new corners. Project partners and stations initiated the formation of nearly a dozen father groups, which are modeled after the longstanding community mother groups, with the goal of uniting male community leaders to teach boys responsibility in reproductive health choices. Father groups have organized discussions for boys about safe sex and informed decision making, and they've engaged these boys in community service projects. We've also seen accountability raised. Again, in Mangochi, 20 girls had dropped out of 3 local schools because of inappropriate sexual comments from teachers. Our youth reporters in the district interviewed the headmasters at each of these schools, and they really challenged them to censure the teachers and about why they hadn't done that. After the stories aired, all 20 of these students were able to return to school, and the headmasters made public commitments to enforcing penalties for teachers' harassment of students. Unfortunately, that was just sort of a handful of the results that we've achieved under this activity, but there are many more similar results. And with that, let's dive into the Q&A. And I hope that you do all have questions. I would invite you to ask if there's anything I didn't mention. I know this was a very short, condensed summary of this years-long activity. So if there's any detail I left out, or anything you'd like to hear that I didn't include, please let me know. Another question I have for whoever is listening is whether you think this approach would be replicable where you are. I think it's a fantastic approach. I believe it's highly replicable because it is so tailored to context-specific environments, but I'd be really interested in hearing what you all think.
There has just been a question that has popped up in the chat. Corey Warnell says, were there any findings from participants that show future projections into their desire to continue in journalism? Did this seem to offer goal setting and skills building in a way that participants could see a new path for themselves?
Yeah, good question. So I'm glad you brought that up because that's one of the results that I actually left out the results summary. Many of our students have finished secondary school now because, as you can imagine, since the program included youth and we've been running it since 2017, a number of people have cycled out of the program. We've seen the large majority of them pass through secondary school, and a number of them have gone on to university, a much higher percentage than you would see in sort of the general population for matriculation to university. And several of them have decided to study journalism. In addition to that, a lot of them have said that we've built multimedia skills, advocacy skills that they do plan to continue using in their work. During the COVID-19 pandemic, we actually had a really unique opportunity to teach a whole new set of skills because we were not able to train in person. And as a result, we then trained the youth journalists to do long distance reporting and to use new types of equipment and new platforms to do that. That in some ways was an opportunity, and we really do feel like we built substantial skills among all of our trainees. Thanks for the question.
I actually had a question. I was wondering why you chose radio as the kind of conduit for this information, and if you think that media like format would need to change when adapting to different countries.
Radio is the most popular form of media, I think probably all low and middle income countries, mostly because it's so accessible. Being able to afford a television is sort of unique, especially in rural areas. Also, signals aren't as good. You can have and use a radio pretty much anywhere. Radio stations get broader coverage. Also, community radio really thrives where print media and television tend to be really centralized and produced mostly in and about urban areas.
Great.
So in terms of adapting it to other environments, I tend to think that radio would be the preferred medium almost anywhere.